the endotracheal tube at the mouth, not out here, at the mouth. And we will untape any tape that's on here, okay? And I'll be holding it, and you will do the oral care. So you'll do the oral care on this side first, which involves a toothbrush and the chlorhexidine. And you brush the teeth and under the tongue, and just like you'd be brushing regularly, all right? You want to clean the entire mouth. Yank or suction nearby that you can suck out any oral secretions, all right? So once you've got this side nice and clean, you're going to have the assistant move the tube over to the other side and hold it at exactly the same place. We have checked, and this says 18, and I will make sure that that's what's in the chart, that it's at 18, okay? So then I'm going to clean this side real well. I'm going to wash off the face. There might be some type of skin protectant on there. There might be some type of skin adhesive to help the tubing to stick better. The whole time, the nursing assistant is holding this right at the mouth. Okay. Why would I want somebody to hold it? Why can't I just...
So it doesn't come in and out.
Okay. Real easy for it to get dislodged, easy for the whole thing to come out. Patient reaches up. I've had a number of patients extubate themselves on me. Not a happy time.
What do you do when that happens?
Oh, basically you want to cry. You get anesthesia or somebody in there to reintubate pretty quickly. And you just hope that they can hang, that they don't need it that bad. But anyway, so you get over here, okay, you've cleaned up, you've finished all the mouth care. Now you want to tape this, all right? So it's kind of hard to do the taping with your gloves on, so you might want to have it ready before you do all the other. And this is like kindergarten 101, arts and crafts. You take a piece of this tape about the length of this table, okay? You want to tear that off. You put a tongue blade on each end, and then you take a strip of tape about 6 inches long, and you put the two sticky sides together. This should be sticky side up. This is sticky side down, right in the middle. Oops. Okay. Then you bring this carefully over here, and the purpose of the tongue blades is to help to guide it under the patient's neck. So you want to grab it on that side. Okay, you want to line up the...
They're folded.
Pardon?
They're folded. I don't know if that matters.
Try to keep it as straight as we can. Okay, the double folded area should go behind the neck where the hair would be. It's just to help keep it from sticking to the hair. All right. Now with the first piece, my side's twisted too. Let's get this.
You want the sticky side up?
Yeah, I want the sticky side up.
Which way are you going?
Okay, let's turn it down this way. There we go. Okay. You can take the tongue blade off at this point. You're going to bring the first side right over and under the patient's nose, over to their other ear. Okay? Like so. Then you're going to take the remaining side, you're going to split this into half, about this far down. You're going to take the top piece, you're going to hold that out and take the bottom piece, and it also goes above the upper lip. All right? So it's like you're crisscrossing it. Bring this piece over here, wrap. You still have your assistant holding all this time. Wrap. You want to make sure it wraps at least twice.
So it's kind of like the NG tube.
Kinda, but a little different wrapping mechanism. Okay.
Does this cause extreme skin breakdown?
That's why you use a skin protectant most of the time under there. After you've washed the face, put some skin protectant under there. Okay, next week, I will take off points if you do not do the following. Pull back on this and make sure it feels secure. Okay? After you have taped and wrapped, you want to make sure that's secure in there. I also want to be sure I didn't dislodge it. So how could I tell whether it's still in the
Check the
correct
numbers.
place?
The line.
Check the line, make sure it matches
Check the
what's in
lungs.
the chart. What else?
Listen.
Okay, you will tell me that you're now going to auscultate the lungs and listen for equal air exchange on both sides. Then your final step is just to, this should be dry by now, just go ahead and replace your oral airway, all right? So you're just going to slip that in.
You said we cleaned it with
Just soap and
Soap and
water.
water.
Yeah, to my knowledge, they've not made any other recommendations on the oral airways. Okay, and so,
I have a question.
yeah,
Now, we moved it from this side to this side, which
Mhm.
it looks like we didn't actually do. Should the split tape be on the side that we moved it to?
it doesn't matter too much. As long as you have secure, as long as your tube is secure, okay?
So you said to pull back on the tube, to auscultate the lungs, replace the bite block, and what was the other thing?
Check the
Check.
mark.
Check the mark, yeah. Check your mark here. So you have 3 ways of checking to make sure your tube didn't get dislodged, and you want to be sure you put your bite block back in, all right?
The tube should be in the middle or side.
Pardon?
The tube should be in the middle or the side.
Should be on the side. I really should have put this, because I was switching it to the side, so it should be over here. Okay. But you want to rotate that side every time you do oral care. You want to do oral care 4 times a day. Although I will tell you the book has a discrepancy, and I looked to see whether the new book had fixed it, and they didn't. One place they're going to tell you every 8 hours. Another place it's going to say 4 times a day.
Okay.
So I would say more often rather than less often. Under the ventilator-associated pneumonia interventions, it has it 4 times a day, which would be every 6 hours.
Yeah.
At a different place in the book, it says every 8 hours. So I would go with every 6.
Okay.
I think that would be, and every time you do that, you're switching, because you don't want to cause breakdown on the lips. That sort of thing. That's why you're assessing, and you may wait and tell me after you've done all your other assessment. When you're doing this, you may say, I'm assessing the lips and the mouth now, but you got to tell me that at some point, because it's a point on your
Okay.
check off.
All right.
It's really, it just makes sense. You would be checking for any problems there. Okay? All right. Let's look at one more